नमस्कार, शुभ प्रभात, प्रणाम, गुड मॉर्निंग, सत श्री अकाल, आदाब, सबको प्यार भरी नमस्कार। सभी का स्वागत है इस वेबिनार में। कहते ने मां वर्गा कणछावा बूठा मैनू किधरे नजर ना आवे। नमस्कार, शुभ प्रभात, लैके जिस तो प्रणाम, गुड मॉर्निंग, सत श्री अकाल, छां उधारी रब ने स्वर्ग बनाए। नमस्कार, सभी का स्वागत है इस वेबिनार में। एक मिनट लगेगी थोड़ी सी। अभी जो वेबिनार आप देख रहे हैं इसमें माँ का रोल क्या है हमारे जीवन में। जिस माँ के गर्भ से हम पैदा हुए, जिस माँ के गर्भ में हमारी उत्पत्ति हुई, जिस माँ के गर्भ में रहते हुए हम माँ की नाभि से जुड़े और उस माँ के साथ जो भीतर हमारा तालमेल रहा, प्रकृति ने इस पूरे ब्रह्मांड को रचा है और प्रकृति के आगे जो सृजन है वो माँ के हाथ में है। 9 महीने माँ बच्चे को गर्भ में रखती है और वो प्रकृति की एक ऐसी क्रिएशन को क्रिएट करती है जो कि इंसान का रूप धारण करता है। और कोई भी स्त्री जब तक माँ नहीं बनती तब तक वो उस प्रकृति का साइकिल कंप्लीट नहीं होता। तो जिस सिस्टम से साइंस की बात करें तो जिस सिस्टम से होती है, हमारा जन्म होता है, उसमें कुछ ऐसे विकार आ जाएं, उसमें कुछ ऐसी व्याधि आ जाएं जिसमें कि बच्चे के पैदा होने में कोई व्याधि उत्पन्न हो, उसको कैसे दूर करें, उससे रिलेटेड जो प्रॉब्लम है PCOS या PCOD, उसके बारे में बहुत बेहतरीन जानकारी मिलेगी आपको आज इस वेबिनार में। तो उसके लिए हमारे पास हैं मैडम नीरजा चावला जी। स्वागत है मैम आपका बहुत बहुत। मैडम डॉक्टर सपना नंदा जी, प्रिंसिपल गवर्नमेंट कॉलेज ऑफ योगा एजुकेशन एंड हेल्थ। और इसके बाद मेरे सहयोगी होस्ट स्पीकर मैडम सर्गी कोहली जी, जो कि आपको बताएंगे कि योग के माध्यम से कैसे हम इस प्रॉब्लम से बाहर आ सकते हैं। के बारे में तो 3 महान हस्तियां हमारे साथ हैं और इस जो जन्म की जो ये प्रकृति का जो सुंदर रूप है उसके आ रही व्याधियों को किस तरह से दूर करें और जो सुख है प्रकृति के अंदर एक निहित होने का, उसके भीतर समा जाने का, वो माताओं को कैसे मिले, तो इसके बारे में जानकारी लेंगे हम आगे इस वेबिनार में। तो जुड़े रहिए हमारे साथ। अभी मैं माइक हैंड ओवर करता हूँ मैडम सर्गी कोहली को आगे के लिए। जी मैम।
Thank you, Roshan sir. Heartiest greetings and a very warm welcome to everyone. It is my sheer pleasure to be part of this webinar being organized by Government College of Yoga Education and Health in collaboration with the PCOS Society of India. And I feel privileged to be sharing platform with Dr.Nirja Chawla, a renowned gynecologist and an expert in her field. And I also express my heartfelt gratitude to our revered principal, Dr. Sapna Nanda, for giving me this opportunity and always motivating us with her dynamism. Today, we have all gathered here to address a very common problem faced by girls and women in their reproductive years, that is polycystic ovary syndrome, commonly termed as PCOS, which is a hormonal reproductive and metabolic disorder. PCOS has taken the life of women by storm through its disturbing symptoms. Because of the lack of awareness and proper knowledge, women tend to live with their lives in this condition, and due to lack of proper diagnosis and management, they sometimes suffer from the serious complications. Since September 2020 is being designated as the PCOS Awareness Month, this webinar is part of an initiative to raise awareness and help improve the lives of the women suffering from this condition. So today we have with us Dr. Nirja Chawla, who is our worthy guest speaker, who will be sharing her insight with us today and telling us about what is PCOS. So I now request our worthy principal, Dr. Sapna Nanda, to please introduce and formally welcome our esteemed speaker. Over to you, ma'am.
Morning. Namaskar. A very blessed morning to all our viewers on behalf of Government College of Yoga Education and Health and PCS Society of India. I extend a very warm welcome to all our esteemed viewers who have joined us for this webinar on PCOS, polycystic ovary syndrome, understanding and management. As Sarghi has already told, this is September month is PCOS awareness month. But the purpose is not only to spread awareness, but keeping in mind the felt need to spread the awareness as the prevalence is too high. And it is estimated to be around approximately 2 to 20% in the reproductive age group. So usually it is said that women in the age group of 18 to 44 years, but to my understanding, it is right from onset of menarche till completion of menopause, the whole span of reproductive age. And this is the most common endocrine disorder among women. And when someone is infertile due to lack of ovulation, and this can be PCOS is the most common cause. And it is characterized by set of symptoms like irregular or no menstrual cycle, heavy periods, excess of body fat, and then facial hair, acne, pelvic pain, difficulty in getting pregnant, or patches of thick, dark, or velvety skin. And the associated symptoms include sometimes type 2 diabetes mellitus, sometimes obesity, then obstructive sleep apnea can be there, heart disease, mood disorders, and sometimes it can be, no doubt in rare cases, it can be endometrial cancer. And it is sometimes also referred as PCOD, and when there is presence of cyst in the ovaries. And if we, our guest speaker is here to tell us more in detail, but to my understanding, it is due to the elevated level of androgen, that is the male hormone among females. And if we go see the risk factor, there can be genetic factors, there can be environmental factors. And if we see the environmental factors, obesity is the most common cause. It can be most common risk factor besides lack of physical exercise, or it can be family history of this particular condition. And diagnosis is based on 2 of the following conditions. It can be out of 3 conditions: either there is no ovulation, or high androgen level, or presence of ovarian cyst in the ovary. So to have better understanding of the condition, we have a very renowned gynecologist, Dr. Nirja Chawla with us. She is MD in gynecology, and she is gold medalist and has several distinctions at university level, and holds first prizes at the college and university level. And madam is former consultant, Department of Obstetrics and Gynecology, PGI-MER Chandigarh, and she is vice president, FOGSI Nadran Region, also chairperson of Digital Education Committee, Indian Menopause Society. She is patron, executive member, PCOS Society of India, and madam is ex-president and founder convener of Chandigarh Obstetric Gynecology Society and Indian Menopause Society of Chandigarh chapter. She is also founder, life member of Indian Society of Minimal Access and Gynecology, Endoscopy, Urogyne Surgery. And she is also director, Gynae Infertility, Minimal Access Surgery and Gynae Endoscopy Center, Chandigarh. And madam has a passion for this field, and she's a pioneer of endoscopic surgery in this region. And she has great interest in gynae endocrinology, infertility, and menopausal medicine. And above all, she is a very pleasing personality with all qualities of head, heart, and soul. We are fortunate to have her presence amongst us, gracious presence among us. And she has spared her precious time to be with us, to share her knowledge, her experience, vast experience, lifelong experience in this particular field, to spread the message of awareness about the understanding of PCOS in detail. We welcome you, ma'am, on behalf of my entire faculty, on behalf of Government College of Yoga Education and Health, our yoga practitioners, yoga enthusiasts, and my Indian Dietetic Association. And we are so fortunate to have you with us. Welcome you, ma'am, once again. And over to you, ma'am.
Thank you, Sapna. And a very good morning to all of you. I'm just sharing my screen. So here we are. And just give me a moment, please. Can you see my screen? Can you see my screen?
It's fine.
Yeah.
It's fine. It's visible.
Yeah. So a very good morning to all of you, all the viewers, as well as anybody who might log in later also. And thank you, Sapna and Sarghi and Roshan and all your technical team, Rahul, Deepak, all your teachers who have actually endeavored to make such things possible. It is so important that there are diseases, but public awareness of them is also equally important. And you're doing a great job. And you'll be happy to know, like you mentioned, that we have the PCOS Society of India, which is working on the research and education of PCOS in India and abroad. So my talk is on the basics and a very simple understanding, which I was a little amused that Sapna has already known it. She already knows it, but there may be many people who don't. So it's for that reason that I'm here. And let's start with the terminology. So PCOD, the D stands for disease. So we don't call it a disease anymore. It's called a PCOS, P standing for poly, which means many, cystic means fluid-filled structures in the ovaries, and a syndrome, which is a wide group or a spectrum of symptoms and signs. So the symptoms means what a patient notices or feels. Mujhe ye hua, I think I have this, I have a fever, I have this, I have excessive hair growth. Those are symptoms, what the patient will come and tell. But signs are those what the doctor sees. So those are signs. Like Sapna has mentioned, it's a very common disorder. And even though it says 18 to 44, we have patients as young as 14 years and 13 years crowding our OPD with PCOS. So the signs and symptoms, the most important is an irregular or a delayed period. So what is a normal period? So normal period is, say, 28 plus minus 7. So 28 plus 7 would give 35 days. Anything more than 35 days interval. Just remember that all people must know how to calculate this. The first day of the period is day 1. So from that, if you do not have for 35 days, then you've had a delayed period. Or if it is less than 8 periods in a year, or no period for more than 4 months. So it could be prolonged. The definition is more than 7 days. It could be scanty or heavy. Now, obesity is another feature of PCOS. Now, the definitions of overweight and obesity is 10% of weight for height. Now, suppose by an average, if a person is 5 feet 3 inches, so it's sitting in the OPD, we don't pull out all these charts. We say, okay, your average weight should be 53. So 10% of that will make it 58.5. 20% of that will make it 63.6. So for your height, if you're more than 10%, you're overweight. If you're more than 20%, by definition, you're obese. Then there is features of androgen excess, which are male hormones. You must remember that every person, male and female, they have female hormones as well as male hormones. In the females, the female hormones are dominant and the male hormones are dominant in the male. So if this changes in the female and the male hormone becomes dominant, then that is known as androgen excess. And how do you see that? You have features of facial hair, upper lip, mustache area, the beard area, the chin, front of the chest, which is actually between the breasts, or it could be the pubic pattern, which is an inverted triangle. if this is the umbilicus, then an inverted triangle, not an inverted triangle, a triangle of hair growth starting from the pubic line is a male pattern. Then the inner side of thighs. Acne, oily skin is a male feature. Female feature is a smooth skin, frontal balding, the trunk. Now females have an hourglass figure. Now when this hourglass figure becomes straight or there's fat in the truncal area or mid-abdomen, that is a male feature. So the other thing that the patients could have is infertility. And what is you would see is this thick black velvety skin at all the body creases, all or some of them. This is known as acanthosis nigricans, and this is what it will look like. And anywhere you have this velvety skin appearing, this indicates that either it is pre-diabetes or the patient has diabetes. So just a simple line diagram, which I share with even my 14-year-old and 12-year-old girls, which I'm sure you will understand. So let me start by saying that day 1 is the first day of the cycle. In a normal cycle, it would be a 28-day cycle, presuming it's a normal thing. That is actually the day 1 of the next cycle. So according to this, on day 12 to 14, there is the release of the egg, which is called ovulation. Now this time from the release of the egg to the period which is going to come, this is fixed at 14 days. Now, and this first half of the cycle, the hormone that is produced is estrogen. In the second half, it is progesterone. If this egg release doesn't happen, then this progesterone is not produced, and such people are estrogen dominant, which is why they have increased incidences of uterine cancers. Now, if this egg release is delayed by 1 week, then this period also will shift by 1 week. And if this egg release doesn't happen at all, then where will the period come? So I generally say it'll come here, it'll come here, it'll come here, it'll come here. It can come anywhere. It's a delayed and irregular period. So this is what will happen. Now, this is a picture of the ovary, a magnified diagram where you see the follicle from the primordial follicle starts maturing, growing, and then it ruptures. This follicle will release this egg, which will happen on day 12 to day 14. Now, in the normal ovary, this cycle of the primordial follicle maturing and releasing, it happens. But in the polycystic ovary, these follicles get arrested in their development and they form a string of cysts in the outer edge of the ovary, which is classical of PCOS. Now, this string of pearls, what it's called, or these cysts, they do not cause the PCOS. They are there because of the PCOS. So if there are cysts and you say treat these cysts, no, you have to treat the PCOS and the cysts will go. So that is how it works. Now, why? Why is the ovulation delayed or it's absent, leading to a delayed period? So I will say in a very boring fashion: excessive eating, excessive fasting, excessive weight gain, excessive weight loss, excessive exercise, excessive no exercise. So I'm going on badgering on the word excessive. What I'm trying to say is that anything that is excessive will actually disturb the homeostasis or the metabolic system of the body. You have to do everything in moderation. This is the way life is, like a pole. You know, a walker on that pole with that poles like this. If you do this, you'll fall. You do this, you'll fall. You have to walk balanced. Now, if the girl is sexually active, then a delayed period, the first thing that you will think of is, of course, pregnancy. Then you have things, other causes like obesity. Now, to help you understand this, just think that under the skin, there is a lot of fat. Now, this fat is actually a factory. It converts male hormones to female hormones, female active to inactive, inactive to active. So that it's a factory which continuously goes on. If this fat is more than a particular threshold level, then it will disturb the system of the body. Then there are other important causes like hormonal and stress. So when you come to hormonal, I would say that PCOS is a hormonal problem. And it is interconnected with all the hormone producing glands, which are called the endocrine glands. You have the gonads or the ovaries right at the bottom. And then you have capping the kidneys, you have the adrenals. Then above that, there is pancreas. Now the adrenals are going to be responsible for the male features. Then you have pancreas with islets of Langerhans, and those are responsible for the diabetes or the insulin resistance. Then you have the thyroid, which will be responsible for your weight and blood pressures and other things. Now, these are all interconnected and they control each other's function by short and long loops this way. So they are all controlling each other. But what controls them? They are controlled by what is known as the master gland, which is the pituitary. So the pituitary is the master gland which controls all of these. But what controls the master? Somebody has to control the master also. And that is the hypothalamus and the hippocampus, which are the higher areas of the brain, the cortex and the other areas. And these are under the control of stress. So stress is the key feature in these patients of PCOS. Now, why PCOS? Let me just knit it together and say that yes, there are genetic causes. Here I want to point out to you that even the father who is very, very hairy, very, very man, that kind of fathers, they have a possibility of having PCOS daughters. So the genetic part can come both from the mother and the father. And we know it's a metabolic syndrome. And the risk factors would be, of course, the family history of PCOS and these lifestyle disorders of diabetes, obesity, and less exercise. PCOS is also low-grade inflammation, and these inflammatory markers are moving around in the system. And these are due to insulin, the androgens, and the obesity. So what are the diagnostic criteria? How do we say that this particular person has PCOS? So there are different definitions given by different societies. What we generally follow in clinical practice is the Rotterdam criteria, which is any two out of the following. So delayed or absent egg release, which means delayed or absent period, and excess of male activity, and polycystic ovaries on ultrasound, although they are present in only 15% of the patients. So you may not see in all, but any two of these three means the patient has PCOS. But you must remember that there are many other causes of their problems. There may be other causes of the obesity, other causes for the androgen excess. So those also have to be ruled out. So what are the tests or the screening that we do? We like to screen such patients annually. There are some recommendations and guidelines which say screen them every 2 years, but generally we do screen them annually. And what we do check is their height, weight, and their BMI, body mass index. For India, the body mass index, the limit is different. So I need to tell you that it is 23 for overweight and 25 for obesity, not like the Western world, which is 25 and 30. So waist circumference, which is measured midway between the ribs and the iliac crest, at that point, it should be less than 80 centimeters. The waist-hip ratio should be less than 0.81. Then there is acanthosis nigricans. We are looking at all this. There are hair abnormalities and there is discharge from the nipple. So we will also test for the sugars, liver functions, lipids, thyroid, and the breast discharge here is actually due to prolactin, which is from the anterior pituitary. So we check that, and we check also just one moment, please. We check for the inflammatory markers also. So these other tests, these will depend upon what the patient needs. Androgenic hair, then this. We are suspecting Cushing's syndrome, then this. If the patient wants pregnancy, then AMH. So differently for their requirements. Now, should you treat PCOS? See, when in the 80s, when I was doing my MD, mid 80s somewhere, at that time we used to say if the girl doesn't want a pregnancy, no need to treat. But we are wiser now, we know better. So whether or not the patient wants a pregnancy, PCOS must be treated because PCOS is a metabolic syndrome, and metabolic syndrome is twice as that of a normal population. But what exactly is metabolic syndrome? Metabolic syndrome is actually a collection of some problems in the person which are very dangerous, high risk factors for heart attacks. So 10% of these patients have diabetes, which is 5 times more than a normal population. By the age of 30, at least 5 times more chances. There is a 30 to 40% chance of these patients developing the diabetes. 10 to 40% of them have high blood pressure. 70% have at least one lipid abnormality. 80% of them are obese, and the risk of heart attacks is doubled. Now, the question arises in everyone's mind that this is all obese, obese, obese. What about those PCOS who are lean? We call them lean PCOS. These are the thin PCOS. What about those? Now, you must remember that the critical part of PCOS or the metabolic syndrome is obesity and insulin resistance, which is diabetes. But obesity is not the primary feature. It is the insulin resistance. So the lean PCOS also have insulin resistance, though at lesser levels than the obese, and they are also at increased risks of metabolic syndrome. Other complications of metabolic syndrome, and if you do not treat PCOS, so 60% of them will have fatty liver. 20% of these will go on to NASH or inflammation of the liver. 50% will then develop fibrosis. 5% will develop cirrhosis, and 2 to 3% will develop liver cancers. So 0.5% of patients with fatty liver ultimately over time will develop liver cancer, even though they are not alcoholics. So sleep apnea occurs. 50% of the obese will have sleep apnea. 28 to 60% have depression, abnormal bleeding in 70%, risk of cancers of the uterus 3 times more. And there's problems in pregnancy, in the conceiving, the maintenance, and the medical problems also increase. So the message is that don't ignore PCOS. You can prevent the complications and you can reverse the symptoms. But at the same time, I want to say that there is no cure for PCOS. There is no cure. Now, how do you understand this? If you have a boil here and your doctor is giving you antibiotics and whatever, this boil goes away. So your doctor has cured this boil. But whatever you do, you cannot cure the PCOS, but you can prevent the complications and give symptom relief. Then how are you going to manage such patients if there is no cure? So how do you manage? Look at this very interesting flow chart. A patient, the fatter she is, then there is no release of the egg. And because of that, the periods are delayed. And because of this, there's difficulty in conceiving. And because of this syndrome, there are male features. And these male features make her more obese. And this goes on and on and on and on. It's a self-perpetuating cycle. So this self-perpetuating cycle, you can break if you break any link of the chain. So how do you decide which link to break? For that, the patient is the king or the queen, so to say. So if the patient wants to have a pregnancy, then you will attack this link and cause release of the egg. And of course, treat the other problems which will have problems in her infertility. But if the patient doesn't want a pregnancy, young patient or even married but doesn't want a pregnancy, then you will regularize her cycle by oral contraceptive pills, which have many other advantages also. So this link is broken. And if there are male features, you treat that. So when you break this link, this entire chain can reverse. But what will the patient do? What will you contribute if you have PCOS? You will break this link of obesity by lifestyle modifications. So the key to the management of PCOS is lifestyle modifications. And what I'm going to talk here is all research-based. I have not put references, but it is research-based. So lifestyle modifications is superior to any drug alone. If the patient is being given drugs for something or the other, hair or whatever, even then lifestyle modifications should be added. For obese PCOS, weight loss is crucial. How much? A modest decrease of 5% in the initial part and maintain it to 10 to 20% of your weight that you are now. How do you do this? By decreasing your calories. If you decrease 500 calories per day, you're likely to lose 1 kilogram in 17 days. Take smaller plates, smaller portions, no second helpings. Now, the questions which we are often very asked is about Mediterranean diets, paleo diets, Newcastle diet. So all these diets, this is research based. There is no special diet which is superior to intermittent fasting. All these diets are actually myths. So intermittent fasting is the key. And at this point, I would encourage you to go to the YouTube channel of Digital Education Indian Menopause Society, where we have an excellent talk by experts on PCOS and intermittent fasting. It will benefit you. So you can change the diet, use complex carbohydrates, high fibers, and this is an anti-obesity diet. What have you done is, you have decreased from 55 to 50 of carbohydrates and increased the proteins from 15 to 20. So this is called an anti-obesity diet. Exercise, it does help in weight loss, but is much less than diet. The contribution of weight loss is 80%, 20% with diet. And exercise, even though the weight loss is not good, but it reverses all the metabolic processes. But do remember that you cannot exercise out of a huge American style unhealthy diet. Among the exercises, research says that a combination of aerobic and resistance decreases insulin resistance. But if you add stability and flexibility, you're decreasing the boredom, you're improving the compliance. And this is where yoga comes in. Yoga also helps in stress management, which is the other leg. If one is weight, the other is stress. What about the lean PCOS? They don't need weight loss, but they will benefit from isocaloric diets and exercise and stress management to decrease or reverse their metabolic syndrome. So finally, PCOS is very common. For diagnosis, you need 2 out of these 3 criteria, but other causes should also be ruled out. Don't be blind to the other causes. Fathers too can cause this, but remember that epigenetic causes in what you are can overcome what is your genetic basis. It is a metabolic disorder. There are risks to it. So treatment is necessary. There is no cure, but symptoms are reversible. The medicines are given according to the symptoms and whether the patient wants pregnancy or does not want pregnancy. The most important is lifestyle modifications. So thank you all for a very patient hearing. And I will be open to questions whenever Dr. Sapna decides. I will just stop screen share. Okay.
थैंक यू सो मच मैम, आपने इतने सिंपल वर्ड्स में इतना कॉम्प्रिहेंसिव मैनर में इतने एग्जॉस्टिवली एक्सप्लेन कर दिया कि फॉर अ ले मैन इट्स क्वाइट सिंपल टू अंडरस्टैंड कि व्हाट PCOS इज, व्हाट आर द causative factors, risk factors, and what are the symptoms. And as you have told, there is no cure of PCOS as of now. So the only key is management of PCOS, and management includes, as you said, it is lifestyle modification. So lifestyle changes can be such as weight loss, either through both through the dietary management as well as through physical exercise like yoga and asanas, and also to regulate the blood sugar level, insulin level. And as you have told, insulin, I hope everyone must be understanding that insulin is the hormone which is secreted by pancreas, and it regulates the blood sugar level in the body. And many women with PCOS, they are resistant to insulin, means they are not able to utilize that insulin which regulates the blood sugar level, and this results in producing more insulin to be effective so as to metabolize the blood sugar level. And as insulin resistance is usually the underlying problem, so a diet plan for PCOS should focus on either lowering on insulin level or improving the body's sensitivity to insulin, while also helping with the weight loss program. So diet, we all understand, it has a crucial role in management of PCOS, not only for weight loss, but also for maintenance of weight. As you have told, we can reduce the weight, but it should be reduced gradually. As you have told, 500 calories if we reduce per day, so it can lead to weight loss of approximately 1 kg per week. So, and also the intermittent fasting. So the main goal is to regulate the insulin level. So how to manage the insulin level? It is there is a index known as glycemic index, which is the way to monitor how quickly the blood glucose level rises after eating the carbohydrate diet. And the foods with low glycemic index can cause blood sugar level to rise very slowly. So this glycemic index has a range of 0 to 100, and foods with the glycemic index more than 70 are treated as high glycemic index food. With 56 to 69 are foods with medium GI foods, and foods with less than 55 GI glycemic index are known as low glycemic index food. And this is compared to if we take 50 gram of glucose, so the total rise in blood sugar level is treated as total 100. So in comparison, glucose is taken as the reference with which we compare the glycemic index of other foods. So foods with low glycemic index can cause blood sugar level to rise slowly, and low glycemic index foods can improve and help balance the insulin levels and are helpful in reducing the symptoms of PCOS. So this rise in insulin level means levels of testosterone is also increased, and the increase in both insulin as well as testosterone, which is the male hormone, it upsets the natural hormonal balance of the body, and which often leads to symptoms to flare up. So management of blood insulin level is crucial. It is the key to the management of PCOS. So now the question arises, what foods we can have and how to manage our blood insulin level. So foods which can be eaten include green leafy vegetables and other colored vegetables, except corn and starchy vegetables. We should avoid these roots and tubers, but we can have sweet potatoes, then fruits, all fruits, and high fiber vegetables, because fiber slows down the process of digestion, which causes the glucose to release slowly into the bloodstream. And the foods that are higher in fiber, they don't spike your blood sugar level. So we can have fat and protein, because they have low glycemic index, such as we can have fish or pulses which have low glycemic index. Then besides these, anti-inflammatory foods and spices such as turmeric, tomatoes, and other spices and herbs can be used. And besides this, healthy fats can be eaten, which is a combination of all the saturated fatty acids, monounsaturated and polyunsaturated fatty acids. So such healthy fats should be included, and trans fats should be specially avoided, which have been heated and reheated over a period of time. Now, what foods are to be avoided so as to regulate the blood sugar level and which have low glycemic index? So foods which are high in carbohydrates and have high glycemic index, more than 70 GI score, they are to be avoided, because they break down quickly to release more sugar in the blood, more glucose in the blood. So foods high in protein and fats, they have low glycemic index, so they can be included in the diet. And high glycemic index foods include all breakfast cereals, fruit juices. We can have whole fruit instead of fruit juices. Then all aerated drinks, soft drinks, cookies, candies, white bread, watermelon, other fruits. Unripe fruits we can have for low glycemic index. So as ripening takes place, the glycemic index of fruits also increase. Then diet high in refined carbohydrates, which have been processed, highly processed. So these need to be avoided. Then all starchy and sugary foods need to be avoided, because they can cause insulin resistance, and therefore weight loss become difficult to maintain. Then dairy and soya products, sugary snacks, drinks, And all inflammatory foods like highly processed foods need to be, and red meat especially, they need to be avoided. And unhealthy fats also, trans fats also need to be avoided. So if we sum up the diet, so we should have whole grain foods, which is a multigrain you can say, or multigrain foods we can have instead of highly refined and processed foods. Then we should have whole fruits instead of fruit juices, which will help maintain the insulin level and the blood sugar level. Then eat foods which are high in fiber content. Like usually we remove bran out of the wheat flour, so it should not be removed. Then whole cereals, whole pulses, whole fruits, and then whichever fruits can be eaten with skin. Then salads, fruits should be included in the diet, so as to cause a slower and more controlled rise in blood sugar and insulin levels. Then try to include legumes, pulses, vegetables in your diet, as they are high in fiber and rich in nutrients, and help to manage the blood sugar level. And make combination of protein rich and carbohydrate rich foods, as ma'am has already told. It should be in the ratio of 50:30:20. 50 portions of carbohydrate, then 20 of protein, and 30 of the fat. No doubt good fat, good quality fat. And this will help to regulate the blood sugar level, and it helps to maintain the blood sugar level under control. So as lifestyle modification is the key, so body PCOS responds proactively to the proactive lifestyle choices. So besides diet, and no doubt physical exercise, body movement has a crucial role to play to reduce the insulin level. And when coupled with limited intake of calories, especially carbohydrates, so we can avoid the symptoms of PCOS. So experts agree that at least 150 minutes per week of exercise is ideal to maintain the ideal body weight. Ma'am has already described the distinction between what should be the ideal body weight, and from where obesity starts, and overweight starts, and where it ends, and from where this obesity starts. So body mass index is a good indicator, BMI, and BMI in the range of 18 to 23 is the ideal body mass for Indian adults. So daily activity, low sugar intake, low inflammation diet can lead to weight loss. And ma'am has already said that stress can be one of the reasons and one of the symptoms also. So stress reduction techniques, which helps to calm down the mind and relax the mind. So this includes meditation. We have our yoga expert who will be telling about the role of exercise, yoga, and meditation to manage the symptoms of PCOS. So now I hand over the mic to Sarghi Kohli. Over to you, Sarghi.
Thank you, ma'am, and Dr. Nirja Chawla for giving us a detailed and comprehensive explanation about the causes, symptoms of PCOS and its management through changes in our lifestyle and diet. As Dr. Chawla has already explained that in PCOS, there is basically the imbalance in our hormones. And it is often observed that, and it has been established by the facts that women who are emotionally tense and who face anxiety issues, and they suffer from the hormonal imbalance. We all know that the fast-paced lifestyle, women being the backbone of our family, they have to play multiple roles, discharge different responsibilities at in their families, at their workplace, and so they basically try to be a superwoman, and they neglect their own health and well-being. Now, every day, the women encounter so many thoughts that cross our minds, which can sometimes be disturbing. So these disturbing thoughts, the cluster of these disturbing thoughts leads to tension. And when the tension accumulates, it takes the form of anxiety. And when the anxiety is aggravated, it takes the form of stress, depression, and other psychological issues. So as Dr. Chawla has already told us that Stress has a major impact on the secretion of our hormones from the various glands in our body. And we all know that our mind and body is connected. Our body responds to the way we think, feel, and act. When we are stressed and anxious, our body gives us signals. You might have experienced in your life that whenever you feel any stressful situation, there are changes in your heart rate, your blood pressure changes, or some people even experience headaches or some other physiological changes as well. So our psychological state has manifestations over our physiological health and well-being. PCOS is also a psychosomatic disorder where stress is the cause as well as the effect. And it is here that yoga can play a very positive and key role in breaking this vicious circle as well as managing its various other disturbing symptoms. So we'll have a look at how yoga can be helpful in the management of PCOS through the medium of slides. Now there is general notion among the people that yoga is just for the physical well-being. Whenever we hear about the word yoga, the picture of asanas come to your mind. But no, yoga is just does not focuses on our body, but the mind, the soul, all three as a whole. It is a holistic approach that takes care of the physiological, psychological, and the emotional well-being of an individual. And when we talk about the management of PCOS, yoga can help in treating its symptoms that manifest in our physical and mental body through its various practices like asanas, shatkarmas, pranayam, etc. So let us have a look at those. Shatkarmas. Shatkarmas are the 6 powerful techniques for the cleansing and purification of our internal organs. Now, according to Ayurveda and yoga, it is believed that the imbalance between the 3 doshas, that is Vata, Pitta, and Kapha, when there is an imbalance in the 3 doshas, it results in illness and disease. And the aim of Shatkarmas is to bring a balance in all 3 doshas in our body. Out of the various Shatkarma techniques, the practice which is beneficial in the management of PCOS is Kapalbhati. Kapalbhati increases the metabolic rate and thereby it aids in the weight loss. It also stimulates the abdominal organs as there is rapid expansion and contraction. There is abdominal movement in Kapalbhati. Because of that, it stimulates the abdominal organs and is extremely useful for those with diabetes. It also improves our digestive process and it calms the mood as well. During Kapalbhati, our stomach, while inhalation, the stomach sinks in and vice versa. Due to this abdominal movement, it is beneficial for the muscles around it, including our liver, pancreas, as the blood flow to these areas also increases. And there is one added benefit also that it also brings glow and shine to the face. All the more reason for the women to practice it. So it is beneficial in the management of weight, diabetes, mood swings, which are the symptoms of PCOS. So beginners can start with 3 to 5 rounds of 30 breaths in a minute and slowly increase the number of breaths to 60 per round. Next are the asanas, which are the physical postures, and the yoga postures, which will be shown in the next few slides. They help in opening up the pelvic area, increases the blood flow in the abdominal region, and which also helps in regulating the menstrual cycle. These postures help to balance the hormones and have a very positive impact on the insulin and cholesterol levels in the women with PCOS, and also aids in the weight loss. Now, according to yogic philosophy, there are 7 chakras which run along our spinal cord. Out of these, the major 2 chakras are responsible for the hormonal balance. That is Swadhisthana chakra, which is related to the female ovaries, and it looks after our kidneys, liver, and lower abdomen. And Vishuddhi chakra, which is related to the thyroid, metabolic rate, and lungs. The asanas, which will be shown in the next few slides, activates these chakras and help in managing the symptoms of PCOS. The first asana, this is Ardha Uttan Pad Asana. As you can see, it is a single leg raise posture. This posture reduces the belly fat and therefore is beneficial in managing the obesity. It also strengthens the abdominal organs and improves the functioning of the reproductive organs. It is also helpful in improving the functions of our digestive system. It can also be done by raising both the legs together, then it becomes Uttan Padasana. But the only precaution which you have to take is that the women who are suffering from a low back problem or slip discs, they should do it with single leg. You can also do it with a variation by stopping at 30, 60, and then 90-degree angle. Take your leg as much as is comfortable for you. Next is the Pavan Muktasana. In this asana, as you can say, our abdominal muscles are tensed and our internal organs are compressed, which increases the blood circulation and improves the functioning of our internal organs. This asana also massages our pelvic muscles and reproductive organs and is beneficial for the menstrual disorders. This asana is also very helpful in reducing the fat of the abdomen, thighs, buttocks, thus is very good for the weight loss. The precaution which should be taken that the women who are suffering from cervical problem or any neck pain, they should do it while keeping their head back on the ground. Next is the Setu Bandhasana. Now this asana, as you can see that in this asana exerts the pressure in your chin area and therefore is very beneficial for regulating the secretions of your thyroid gland. So it helps in reducing the thyroid problem, and it is also giving a stretch in your abdominal area, so it improves the digestion and it is helpful in relieving the symptoms of the menopause and menstrual pain. It also calms the brain, reduces anxiety and stress, and also strengthens the back muscles. Next is the Bhujangasana, a very good asana to ensure better functionality of our ovaries. It regulates the secretions of the thyroid gland as well and promotes metabolism. As you can see in the picture that there is a good stretch in the neck area and the pelvis muscles, the abdominal organs are being massaged, and it also regulates our menstrual cycle and improves in, basically it improves in increasing the blood circulation in the pelvis region and also helps in improving the fertility. The precaution which has to be taken in mind is that those who have undergone any recent abdominal surgery, they should avoid it. It should also be avoided in case of hernia, and pregnant women should also avoid this asana. Shalabhasana. The first picture is of the Ardha Shalabhasana and the second one is of the Shalabhasana, single leg raise and the raise with the both legs together. Now, in this picture, as you can say that, as you can see this posture, your lower body is raised from the pelvis. So it strengthens the pelvic muscles and the abdominal muscles, back muscles, and it also brings about calmness and control of the mind, and an excellent source for the mental peace. The precaution, the women who are having a prolapsed uterus, they should avoid it. And those having acute backache, slip disc problem, they should also refrain from practice, or they can do it with a single raise. The double leg raise should be avoided. Dhanurasana. As you can see in the picture, it is giving a very gentle massage and is pressurizing your abdominal organs. So it is very beneficial in the management of diabetes also, and it reduces the excess weight around the abdominal region, helps in alleviating the anxiety as well, and it stimulates our reproductive organs. Now, it is a slight difficult pose, so you need a little practice for this. So women who have a backache or hernia, they should avoid doing this posture. Ushtrasana. As you can see in the picture, again, this asana is giving a stretch in the neck region and the abdominal region. So it regulates the functioning of our thyroid gland. It is massaging all the internal organs of the abdomen. It aids in digestion. It is very good posture for the weight loss also. And since the pelvis muscles are being stretched, it tones the organs of our pelvis, and it stimulates all the endocrine glands, the kidneys, the digestive system, and also energizes the body. And as you can see in the picture also, it also makes your spine flexible. It is a little difficult posture. So in the beginning, you can do it with a single hand, and then slowly and steadily you can advance towards this posture. Shashank Asana. A very simple but with the multiple benefits for body as well as mind. This asana also tones the pelvic muscles and is beneficial for the women who have underdeveloped pelvis. It has a very cooling effect on your brain and induces relaxation. And it is especially recommended for those who feel emotionally unbalanced and has difficulty in controlling their anger and frustration. So women who have knee problems should refrain from doing this, and pregnant women should also avoid this asana. Vakarasana. As you can see in the picture, this is a twisting posture, putting pressure on our pancreas, and therefore is a very beneficial asana for the management of diabetes. It regulates the secretions of our digestive juices, and it is also very helpful in reducing the belly fat, in the management of diabetes, and regulating the functioning of pancreas in our body. It should be avoided in case of knee pain. Next is the Ardha Matsyendra Asana. This is a little slightly difficult pose, and Vakarasana is a preliminary pose for the practice of Ardha Matsyendra Asana. It has all the benefits of Vakarasana. In fact, the little added one, it exerts little more pressure on your pancreas. Very good asana for the diabetes, obesity, management of the belly fat. Next, pranayama. Now we all know that our breath is the remote control of our mind. Although breathing is managed in unconscious, but we can any moment grab the control of our breathing and consciously change how we breathe. So controlled breathing keeps the mind and body functioning at its best. And pranayam techniques teach us that. first pranayam is Anulom Vilom Pranayam, also called alternate breathing practice. It is an excellent stress buster and it aids mental peace and keeps the anxiety and depression at bay. This practice also helps to remove the premenstrual symptoms, especially the headache. You can practice this pranayam for 3 to 5 minutes. In this, you have to inhale through your left nostril, exhale through your right, and then again inhale through right and exhale through left. This is one round, and in this way, you can continue the rounds, practice for 3 to 5 minutes, and slowly increase the duration for to 10 minutes. Ujjayi pranayam, the victorious breath. In this pranayam, you have to inhale through your both the nostrils with constricted glottis and exhale through your nose. You can even exhale through your left nostril, as the exhale through the left nostril has a very calming effect on our mind. This is an excellent stress buster also, and I have already told that in this the glottis is constricted, so it stimulates and balances the thyroid gland, and it also regulates the temperature of our body. Bhastrika pranayam. In this pranayam, there is rapid inhalation and exhalation along with the abdominal movement. This pranayam is very beneficial for energizing the body and mind. As it is a dynamic pranayam, it generates heat in our body. It generates Jatragni, the digestive fire, and is very beneficial in accelerating our digestion process. It is also very good for people with depression and anxiety, and it checks the sleep apnea as well. It corrects the imbalance of our Vata, Pitta, and Kapha and strengthens the immunity. Now, women with the hypertension and high heart issue should avoid it, and it should never be done full stomach or at night because it revs up the nervous system and it disturbs our sleep pattern. And pregnant women should also avoid it. You can practice it 30 breaths in a 1 minute and slowly increase the duration. Bhramri pranayam, a very soothing and calming pranayam. The humming sound produced by this pranayam generates vibrations that have a very natural and calming effect. It gives relief from tension, anger, and anxiety. It lowers the blood pressure and mitigates the migraine and headache also. It also induces sleep and is effective in the treatment of insomnia. You can practice this pranayam at night also before sleeping. So it is a very good pranayam for people who suffer from sleep disorders. In case of ear infections, it should be avoided. Now, meditation and relaxation have a very positive effect in calming our body and mind. It helps in maintaining the cortisol level in our body, which is a stress hormone, and high level of cortisol causes weight gain, high BP, disrupts the sleep, negatively affects our mood, and contribute in the diabetes, all of which are the problems related to PCOS. So we'll be having a look at some of the relaxative and meditation techniques. First one is Yog Nidra, also called the yogic sleep or the guided meditation. In this, a state is created, a state of awareness is created between the waking and the sleeping. And it is said that 45 minutes of Yog Nidra is equal to 3 hours of normal sleep. In this, our consciousness is rotated in all the different parts of the body, which induces relaxation. Now, researchers have shown that Yog Nidra helps in increasing the dopamine level, which is a very good feel-good hormone. Dopamine relates to feeling of the bliss and also plays a very important role in many functions like sleep, mood, etc. Many studies have also demonstrated that Yog Nidra effectiveness in elevating conditions like type 2 diabetes, PMS, and stress. There is also an evidence which shows that practicing Yog Nidra leads to improvement in depression, anxiety, improves the sleep quality, and reduces the insomnia. Mantra chanting. Mantras are an important part of yogic and meditative practice. They are the repetitive sounds which penetrate in the depth of our unconscious mind and create vibrations in all the aspects of our being. The power of mantras help in establishing a balance in the production of hormones, thus solving most of the issues of the PCOS. It instills peacefulness and also promote mental healing. Mantra chanting is also an effective way to release the pent up emotions, thereby instilling the feeling of lightness. Mantra chanting impacts your whole being, your thoughts, your actions. Now you can choose any mantra which you like. It can be a single syllable, it can be a phrase. The only thing which you have to keep in mind is that the pronunciation and the utterance of the mantra should be correct. So these were some of the practices, some of the yogic practices, which can be helpful in the treatment of PCOS. And summing up, I would like to say that little changes in your lifestyle, positive attitude, proper diet, proper sleep, and incorporating yoga in your lifestyle, it can be really helpful in the management of PCOS. Once again, my heartfelt gratitude to Dr. Sapna Nanda and Dr. Nirja Chawla. Thank you so much.
मैम अभी हम बस 2-3 क्वेश्चन लेंगे. अभी क्वेश्चन आंसर सेशन था, हमने रखा हुआ था, चैट बॉक्स में मैंने लिख दिया था. तो 4 क्वेश्चन जो मुझे इम्पोर्टेंट लगे वो मैंने यहाँ से उठाए हैं. ईश्वर प्रीत जी हैं, ये पूछ रहे हैं व्हाट इज द बेस्ट मार्कर ऑफ इंसुलिन रेजिस्टेंस. काइंडली आंसर.
हाँ जी मैम.
माइक ऑन कर जी मैम, प्लीज माइक ऑन कीजिए. हाँ
कर दिया. So for insulin resistance हम लोग generally तो blood sugar fasting and hemoglobin A1C लेते हैं, but the best marker for sensitivity is HOMA-IR. So that is a homeostatic model of assessment to find out कि insulin कितना है और कितना वो respond करता है. So less than 1 of HOMA-IR is normal, more than 1.9 is early insulin resistance, and more than 2.9 is actually severe insulin resistance, which could be diabetes. तो ये सब ये नहीं करते हम लोग. ये जो स्टैंडर्ड प्रोसीजर्स है ना, ब्लड शुगर, हेमोग्लोबिन A1C, ओरल GTT, ये बहुत इंपॉर्टेंट है. ये हम रूटीनली सब PCOS पेशेंट्स में करते हैं, जिनका बहुत हाई रिस्क है उनको HOMA-IR करना ठीक रहता है. वैसे इट्स अ गुड, सेफ एंड सिंपल मेथड.
जी मैम, थैंक यू. अगला क्वेश्चन है किरण चौधरी जी का. इट इज इम्पोर्टेंट टू टेक मेडिसिन फॉर PCOS.
See, this सबसे पहले अगर कोई PCOS है तो क्वेश्चन ये है कि आप क्या चीज उसकी आप अटैक करना चाह रहे हो. इज इट ओबेसिटी विच इज बॉदरिंग यू? इज इट नॉट एबल टू कंसीव? आपको प्रेगनेंसी नहीं हो रही? इज इट बॉदरिंग यू कि साइकिल्स रेगुलर नहीं है? सो जब ये वाले क्वेश्चंस बहुत क्लियर हो जाएं, इज इट द हेयर विच इज बॉदरिंग यू? अगर इनमें से कोई ऐसी चीजें हैं, द फर्स्ट स्टेप is lifestyle modification. I would always advise कि आप lifestyle modifications को as first step जरूर ले. उसको जब आपने वो ठान लिया कि आपने ये वाला इशू सॉल्व करना है, तो आप उसको करके गिव इट 3 months और 6 months डिपेंडिंग अपॉन योर एज। ना अगर आप 35 इयर्स के आसपास हो और आप प्रेगनेंसी को ढूंढ रहे हो, तो फिर आपको बहुत लेट नहीं करना चाहिए, बिकॉज 35 के बाद वैसे ही नेचुरल फर्टिलिटी कम हो जाती है। सो लाइफस्टाइल मॉडिफिकेशंस स्टार्ट विद देम एंड कंटिन्यू इवन विद मेडिसिन्स।
थैंक यू मैम। अगला क्वेश्चन है वो जो आपने आंसर दे ही दिया, मैं फिर भी रिपीट कर देता हूँ। ये मेल का है, मिस्टर आर के गर्ग का, कि वेदर द विलन इज ओबेसिटी और ब्लड शुगर।
द इंसुलिन रेजिस्टेंस इज द विलन, बट ये परपेचुएट होता है। अगर इंसुलिन रेजिस्टेंस का कोई भी एलिमेंट है किसी में, कोई फैमिली हिस्ट्री है या व्हाटएवर है, जेनेटिक है, कुछ भी है, लाइफस्टाइल है जिसकी वजह से ऐसा है, इसको परपेचुएट चाबी देने वाला ओबेसिटी है। बट द प्राइमरी फीचर इज इंसुलिन रेजिस्टेंस, क्योंकि देखो लीन पीसीओएस भी तो है ना। 20 to 30% PCOS patients are पतले, they are not obese but they have insulin resistance.
जी मैम, एक लास्ट क्वेश्चन है, रुचि गरा जी हैं, ये बोल रहे हैं, वैसे तो पर्सनल कंसल्टेंसी का क्वेश्चन है बट मैं फिर भी पूछ लेता हूँ। ये कह रहे हैं सफरिंग फ्रॉम एंडोमेट्रियस in both ovaries from last 6 years.
Endometriosis.
Yes, endometriosis.
तो ये तो 3 घंटे का पैनल डिस्कशन हो सकता है।
इसलिए मैंने कहा ये थोड़ा पर्सनल क्वेश्चन है उनका, और कंसल्टेंसी का है तो
So she can consult her personally.
Yeah, infertility cause कर रहा है, पेन cause कर रहा है, बहुत बड़े हैं, so बहुत सारे फैक्टर्स हैं जो गलत डिसीजन हो जाता है। So वो पूरा फैक्टर्स देखना पड़ेगा। बट आई हैव अ क्वेश्चन, इफ I can be allowed to ask.
Yes ma'am.
Hanji ma'am, hanji sure.
I'm very fond of yoga. For me, yoga is a lifeline. एंड मुझे ऐसे लगता है एज आई एम गेटिंग ओल्डर, अगर मैंने अपने फेस के रिंकल्स भी डिक्रीज करनी है तो वो योगा से करना चाहिए। सो ऑल द इन्वर्टेड पोस्चर्स आर ऑल एंटी एजिंग। बट आई हैव अ क्वेश्चन कि व्हेनेवर आई डू भ्रमरी, सिंस आई एम नॉट अ म्यूजिशियन, मैं हमेशा आई विल डेमोन्स्ट्रेट, आई डोंट नो व्हाट टोन टू यूज। सो व्हेन यू आर डूइंग भ्रमरी, which is the exact pitch and that to use, because somebody told me वो वाला pitch use करो जिससे यहाँ पे vibrations होती हैं, मुझे तो पता नहीं चलता। So what to do?
Now we have two yoga experts, both of them can answer.
Sarghi ma'am.
Hanji Sarghi.
See ma'am, Bhramri can be done with plugged ears as well, by plugging your ears as well as by not plugging the ears. So as the pitch which you were saying, so it depends upon your breath. You have to synchronize the sound with your breath. You have to inhale, and while exhaling you have to produce the sound, and that sound should synchronize with the length of your exhalation. So this should be like this.
मैं सरगी मैम के आंसर में थोड़ा सा ऐड करना चाहूंगा। बहुत ठीक बताया मैम ने कि ब्रेथ के साथ कनेक्शन है। फिर भी मैम जैसे हम हारमोनियम के साथ सुर हैं, सा रे गा मा पा धा नी सा, मैं थोड़ा म्यूजिक के साथ रिलेट करता हूँ, तो पिच डिपेंड करती है इट कमिंग्स फ्रॉम अवर नेवल, कि नेवल में कॉन्ट्रैक्शन है, फोरहेड शुड नॉट बी कॉन्ट्रैक्टेड, ये बिल्कुल रिलैक्स होना चाहिए। मैं थोड़ी थोड़ी आपको तीनों करके बता देता हूँ बस 1 मिनट में। सिर्फ गुंजन हो रही है, थोड़ी सी पिच हाई कर दो, और गुंजन होगी। और पिच हाई जो करते हैं उसमें कई बार सिर दर्द हो जाता है, 3rd लेवल की। तो तीनों में जिसमें आप मोस्टली कंफर्टेबल हो और आपको एक रिलैक्सेशन डीप इनर आ रही है, वाइब्रेशन आ रही है, लेकिन साथ साथ रिलैक्सेशन आ रही है, तो वो चूज करना है, और सातों सुरों में से जो मर्जी उठा सकते हैं। तो दिस वाज माय आंसर।
थैंक यू सो मच।
तो आज के इस वेबिनार का ये समापन, और इसका एक बार फिर मैं माइक हैंड ओवर करना चाहूंगा प्रिंसिपल मैम डॉक्टर सपना नंदा जी को कि हमारे चीफ गेस्ट, और बाकी जो सर्गी मैम, इनका तो थैंक्स बनता ही है, स्पेशली इन्होंने किया। चीफ गेस्ट का स्पेशली मैम ने टाइम निकाला, उनका एक फॉर्मल थैंक्स करें मैडम सपना नंदा जी।
Thank you, Roshan. Thank you so much, Nirja ma'am, for sparing your time and being with us this forenoon for this webinar and sharing your presentation in very lucid, exhaustive presentation, explained in very simple words for this condition of PCOS. And thank you, Sarghi Kohli, for your very beautiful explanation of role of yogic practices, starting from Shatkarmas, asanas, various breathing exercises, and then meditation for the management of PCOS. And our moderator, Mr. Roshan Lal, and the entire technical team also deserves a big round of applause. So they have been always with us for making the program successful. And big thank you to all the viewers who have joined us, and they join us regularly for our weekly series of webinars. So thanks, a big thank you to all the viewers, and thank you one, and thank you all. Stay healthy, stay happy, and stay blessed always. Be happy, and thank you all. Namaskar.
थैंक यू मैम, थैंक यू। लास्ट में एक दो बात और कहना चाहूंगा, जो सारे का क्रक्स है, जहां से मैंने शुरू किया था, कि माँ की ममता की जो छाया जो माँ फील करती है, वो आप सबको मिले। तो जो मैम ने कहा, बताया कि अपने लाइफस्टाइल का हिस्सा बनाएं, चाहे वो खाना है, चाहे वो योग है, चाहे वो एक्सरसाइज है, चाहे वो इंसुलिन है, किसी भी मात्रा में उसको हमने जिस तरह से डाइट का बताया मैम ने, योगा एक्सरसाइज या प्राणायाम, षटक्रिया, आसनों के बारे में बताया, और पीसीओएस है क्या, इसको ठीक से जाने और इसके बारे में इसको लाइफ का एक हिस्सा बनाए। योग इज ओनली अवेयरनेस एट ईच एंड एवरी मूवमेंट। तो मैम ने बड़ा सुंदर आंसर दिया था कि इसको हम ओवरऑल देखें, लाइफस्टाइल का हिस्सा उसके रूप में देखें, तो फिर बहुत लाभ मिलेगा। तो आप सभी जो देखने वाले, सुनने वालों का, सभी का बहुत बहुत शुक्रिया, धन्यवाद। और अब एक बात और, इस चैनल के बारे में जिस पे आप ये लाइव देख रहे हो, इस चैनल को सब्सक्राइब करो, इस वीडियो को शेयर करो, ताकि और बहुत से लोगों को इसका लाभ मिल सके, वो अपने जीवन का ठीक से आनंद ले सकें और सुंदर तरीके से इस जीवन को जी सकें। तो सबका बहुत बहुत शुक्रिया। थैंक यू सो मच। थैंक यू एवरीवन।
Namaskar.